I'm Gary Chmielewski. I'm a thoracic surgeon at Advocate Lutheran General. I'm the chief of thoracic at Advocate Lutheran General and the regional director for thoracic surgery. I became a physician because I felt like it'd be a quality way to spend my life. And I don't mean to sound corny, but you are helping other people. What you do matters. At the end of the day, I could be on Wall Street and moving decimal places around and make a lot of money, but does it really matter? And with physicians, being a physician, it does matter to someone. Way back when, I actually thought I was going to be a pediatrician or family practice, and I think after that first week of medical school, we're in the anatomy lab, my personality did not fit with that at all, and I quickly gravitated to liking anatomy. My philosophy of care is I see a lot of patients with either lung cancer or esophageal cancer, and not only is my goal to kind of help them with their medical problem, but really my goal is to get them back to their life, as soon as possible. And the way we do that is by using minimally invasive surgery techniques. Right now, my preferred platform for doing minimally invasive surgery is the robotic system. And it allows us to make smaller incisions and do things better and quicker and get them home. For a lung cancer patient, probably 80% of the patients go home the next day. And within a week, when I see them at the office, they kind of look like the people I saw pre-op. They're still getting back to their baseline. When I look at the field of thoracic surgery right now, I really do think that even though VATS is a good technique and much better than doing open surgery, I do think that the robot's the future. I see all the advances coming that way with imaging, and with the software they're coming up with is just getting better and better. So I've seen that platform kind of take off in the last 5 to 6 years. This is all I do, so I don't do cardiac surgery, I don't do vascular surgery. This is 100% of my practice is lungs and esophagus. So not only do I have that expertise, but I've also got a great team built up. Everybody on my team, my physician's assistants, my advanced practice nurses, are all geared to that particular problem. And that's probably the most enjoyable part of my job, is kind of setting up a system at Lutheran and throughout the entire system that can help get patients through these surgeries. You set up a high bar, you set up a high standard, and you apply that over and over again. And then you tweak it. You see what's working, what's not working, and make it better with time. You need to constantly be improving. And that's not only for myself, but for the whole team. And that's kind of the exciting part. That's a lot of satisfaction when you realize that you're kind of participating in something bigger than you are. Compassionate care, to me, means how would I want to be treated, or my closest family member. People are coming to me to see me at the worst part of their lives. They've just been told I have lung cancer or esophageal cancer, or I'm having bad reflux problems and I can't eat and can't swallow. And you just have to empathize with them and think, man, you really are. They really are at a disadvantage. They don't know which way to turn, what to do. And when you're in that position to help them, it's extremely satisfying with time. And like I said, it goes back to what I said before. The things that physicians do, it matters over the course of a day. And that's a great way to spend your days.